The topic of our seminar this week is the inherent treatment plan. We're going to explore all kinds of dynamics and learn new craniosacral relationships and work with those, but the overriding topic is the inherent treatment plan. If there's one thing that defines biodynamic healing work, it is that there's an inherent treatment plan that guides the healing process. And what do I mean by an inherent treatment plan? You have to understand the history of that phrase, and when it came into craniosacral therapy, Dr. Becker published a series of articles that were basically all one article that extended itself, called Diagnostic Touch, Applications and Treatment. Diagnostic touch. In the very act of touching our client, we're in the process of diagnosis. In the very act of making our assessment, you're starting to engage a treatment process with the client. Their bioenergy is starting to treat itself. Their field is starting to self-correct simply by being in your presence. It's the client's system that makes the changes. It's the therapist's job to support the changes that are possible in the client's system. That's why we study. That's why we learn. That's why we practice with other living beings. We're supporting the changes that are possible. One of the things that Roland Becker said is the treatment plan is inherent in the disturbance. That's where this idea of an inherent treatment plan comes from. That means you do not have to go looking for how this body needs to heal itself. You don't have to assess and analyze and figure it out with your mind. It's not a function of analysis or interpretation. It is a function of life and its biodynamics expressing their healing function. There is an inherent treatment plan. The body-mind will heal itself. You have to discover what that inertial pattern is. You have to relate to it on its own terms, hopefully without any expectation. You have to be present to the dynamics that are there because they're there for a reason. And as soon as we're present to dynamics that are taking place for a reason, it's most often true that those very same dynamics say, oh, guess what? Let me show you what else I can do. You haven't seen this yet, but watch. Okay, I've been doing that for 10 years. Just watch what else I can do. I want to show you this now. And that's when potency changes from its protective function into its healing function, and life reorganizes.